People come into treatment for sex addiction because they've had some kind of crisis in their lives related to sex. That's what drives someone to a treatment center like the Sexual Recovery Institute or the Ranch. So what happens is a wife has found out something, a boss has found out something, you're looking at porn in the workplace, someone found out about an affair, or they saw all the money you were spending on prostitutes on a credit card or something like that, and they say, this is unbelievable, I'm not putting up with this, and then the person ends up seeking treatment or help. But once they get into treatment, it isn't only the sexual behavior that we're treating. I mean, our primary goal in sex addiction treatment is to stop the sexual acting out behavior, because that is the cause of all the symptoms. That's the cause of somebody's self-hatred, that's the cause of someone having an angry spouse, that's the cause of them risking arrest or disease. The sexual behavior themselves is the cause of all of those things, but there are a whole lot of issues that underlie it. There are people who have recreational sex who don't do it compulsively, addictively, or in ways that cause them to have consequences. That's very different than most sex addicts. The sex addicts are engaging in recreational sex over and over and over again, not as a means to go out and have fun and distract themselves, but as a means to calm themselves, soothe themselves, and deal with emotional problems that they have not found another way to deal with. So a shorter way of saying this is that sex addicts have a problem, and it isn't just their sexual behavior. There are a lot of emotional deficits and challenges in dealing with stressors that other healthier people may know how to handle, that sex addicts will use sex to soothe and medicate. So for a sex addict, sex becomes the medication, it becomes the drug, it becomes the way to distract and comfort themselves rather than a recreational or intimacy building experience.